Sin taxes are designed to limit the consumption of harmful products, such as tobacco, alcohol, and sugary drinks, that threaten public health. The World Health Organization defines these taxes as excise taxes, SCTS, that aim to reduce health risks across society. Tobacco products and sugary drinks are among the most important targets of these policies. Smoking increases the risk of heart and respiratory diseases, while excessive sugar consumption is linked to obesity and cardiovascular disease. Research shows that these taxes can discourage consumers from buying harmful products by raising their cost and have a significant impact on healthier alternatives, especially in regions such as Latin America, where lifestyle-related diseases are on the rise. High rates of unhealthy outcomes were found, especially for sugary drinks. High-income countries have seen significant reductions in consumption following tax increases. These taxes have a major impact not only on health but also in economic terms, with the additional revenue generated being used to finance health systems, reducing pressure on existing resources. However, in low and middle-income countries such as Latin America, the effects are more complex. This is because the policies are not yet widespread and cannot be implemented in an economically stable way. Sin taxes differ from other indirect taxes in that they are levied on the sale of harmful goods, not directly on income. Through this system, governments can both protect public health and reduce consumption while generating economic gains. The need to raise additional funds for health expenditures further increases the importance of these policies in Latin America. Health funding is often inadequate in the region, and obesity and tobacco use are widespread problems. Sin taxes can be a powerful way to support public health, especially given that more than 20% of the youth population struggles with obesity. Compared to OECD countries, countries in Latin America generally have lower sin taxes. However, consumption of tobacco and sugary products remains high across the region. For example, while cigarette consumption is low in some countries, such as Ecuador and Peru, there are between 50 and 1,500 cigarettes per capita across the region. But can sin taxes change this? Research shows that, properly implemented, it is possible. While positive results have been achieved in high-income countries such as the U.S., it is unclear whether this success can be directly translated to Latin America. Regional, cultural, and economic differences are among the factors that influence the performance of these policies. Therefore, a comprehensive review was conducted to understand the impact of sin taxes. Analyzing 34 different studies, this review shows that taxes reduce demand for harmful products, create new sources of revenue, and improve public health by reducing disease risks. However, their impact on health varies across countries. Factors such as smuggling, consumer behavior, and demographic differences can complicate the effectiveness of these taxes. Research shows that these taxation policies are mostly focused on tobacco and sugary drinks. Countries such as Mexico and Brazil provide striking examples and pursue effective policies by taking significant taxation steps on sugary drinks. The findings suggest that sin taxes are an effective tool for protecting public health and funding health services. However, for these taxes to be successful, they need to be continuously monitored, supported by policies, and rigorously implemented. With the right strategies in place, Latin American countries can use sin taxes as an effective policy tool to improve public health and generate critical financial resources for health services.